think GPs play an important role in children's health in general. They're kind of at the centre of the hub and spoke type model. Very important having an overview of their overall care for children.
The GPs in primary care are absolutely vital to this process. It's almost more important than what I do, which is trying to support when disaster has struck already. But the key factor about primary care is it will prevent some of these children ever getting to the stage of needing our help.
As a GP, I will be involved with their care right from the beginning when it's being diagnosed, and then once it's diagnosed, is with their ongoing care management and setting up their asthma care plan.
Asthma remains underdiagnosed. Again, a couple of reasons. Primary reason is we can't diagnose the patients that we don't see. So it's around awareness in the community. And then the second part is when the conditions are low, it may not necessarily be at the forefront of people's minds, or there may be a disinclination to label someone with a diagnosis.
Good in asthma will mean that they have no crisis, there's no flare-up, no A&E admission, and they can continue to do everything that they want. We've got excellent care in some areas, but sadly that's not the case throughout, and we're, as a profession, we are doing a lot to make sure that all that standard is lifted up so that parents and families, wherever they go, they can expect best standard.
I don't think asthma it's considered as important as it should be in primary care, and that's probably because it's so common.
If we were able to review the children and the severity of the condition and make sure we had the children compliant with their medication, knowledgeable in their disease, able to take their inhalers effectively, we would probably be able to stop at least 70% of the asthma admissions and probably around about 90% of the deaths. The problem is that is a time-consuming process.
There's been no management or plan made by my GP, just was given the prescription for my inhaler and that was it.
My doctors haven't been involved in it because they are involved, but they can't really deal with it because you only have 10 minutes at a GP appointment.
I don't think you can do an asthma review in 10 minutes, it's just not possible. Particularly with young people, because you have to build a relationship initially, you have to talk to them. Asthma may not be at the forefront of their minds, so you may initially have to work towards talking about the health issue.
The real tragedy when we come to look at the admissions and we look at the really severe admissions to ITU, there has often been a pattern behind their disease. Their disease has been out of control for several weeks to months beforehand, and in many respects some of this is predictable if one looks at the right patterns and at the right kind of review process.
Yeah, so follow-up is very important, both for monitoring kind of day-to-day symptoms and follow-up after an asthma attack.
We want every child and young people have their own asthma plan so that everybody is aware and in the same communication of what their plan should be.
There is more awareness now in primary care and a greater move towards early diagnosis and ensuring proper treatment and follow-up. So there is a big change happening within primary care.
So my message would be making every contact count, that every time you are approaching a young person with asthma, making sure that they know the plan and making sure that the plan is up to date. And if there was any issue, please send them to us. We're just so much more than happy to see them.
So to improve asthma treatment, we would need longer appointments and the use of a written asthma management plan. A combination of these two things would really significantly improve outcomes.